We're all united against the passage of FOCA, the Freedom of Choice Act. A number of published reports and comments suggest the bill will never make it out of committee. Are you receiving reliable reports about the bill's prospect? If indeed FOCA is not going anywhere, is there a danger that our efforts to defeat it will distract us from other important concerns? FOCA is a bill that was introduced in the last several Congresses. It has not yet been introduced in this Congress. And I think in part they might hesitate to introduce it because there is this organized opposition to it. So the organized opposition to FOCA or its equivalent is extremely important, and I encourage you to do the postcard campaign and help others whom you know to be part of that. We have to have some millions of indications to the politicians who pay attention to something like that, that the FOCA bill cannot pass. I suspect the FOCA bill as FOCA will not pass. We'll see if it's introduced. We'll see what will happen. What they will do is try to introduce the provisions of FOCA in other bills. There's an Access to Health Care Act coming along with many of the provisions from FOCA. There are the funding bills coming along in March and April, and we'll see what they're going to fund. What we have to be concerned about is the funding of abortion using public money, using tax money, your money and my money, because that is to use money for an immoral purpose. There are two other things that we have to be careful of. No matter what the bills are called, or no matter what the executive order says, there are many people now in our government who think that abortion is not just a necessary tragedy sometimes, that's the old language, but rather it is a human right, and therefore can never be limited under any circumstances. That shift from tragedy to human right, and therefore something good in itself, is something we must absolutely say cannot happen. I don't know if you remember at the Cairo session of the United Nations some years ago, the then Clinton administration tried to get the United Nations to say that abortion is a human right, and it was the Holy See that came in against our government with the help of Latin American countries and a lot of Muslim countries to stop that. The United States administration will probably try to start that movement up again. So we will see how that movement to make abortion a human right that isn't just permitted but is encouraged in law fares. We must be against that. The third thing that we have to be really careful about is that the government does not take away the conscience clauses. Right now you have a right, both in Illinois and in the federal law, to say, I cannot do an abortion, I cannot contribute to it, and the institutions, like our hospitals, have that same right. What they might say is, if a hospital receives federal money, it can't claim that right, and individuals, if they're doctors and nurses, cannot refuse this service. Then you have a supposed to be democratic country forcing its citizens to do something they know is immoral. Then you have the destruction of the witness that Catholic hospitals give now. They are the only entirely safe place in our country. They're the only medical facilities where no one is ever deliberately killed. If we cannot keep that witness, we will have to make the hospitals not Catholic or close them entirely. Nobody wants that to happen, I think. And we have to be very clear that that will happen if the provisions of FOCA are pushed along, even though it's not called FOCA any longer. So we have to stay alert on this, and since it will be done piecemeal, it's going to be far less easy to defeat. Already, the president has taken away the Mexico City policies, which means that now our tax money is funding abortion overseas. When I was traveling in Africa in the 80s, in the Congo, I used to go into villages, and the people would complain because there were no Congolese government clinics. There was only the Sisters Clinic very often, a small Catholic clinic, and a U.S. aid station. If you went to the Sisters Clinic, you could get some basic medicines like aspirin and the rest, because there was very little medicine in the Congo, still isn't. If you went to the U.S. aid station, supported by our tax money, all you could get was condoms. And the people complained about that. They said, doesn't your government want us to live? They want us to do away with our children. That's the impression. That's why there's so much anti-Americanism out there. We are aggressively, at least we were under the Clinton administration, pushing abortion and birth control onto people who don't want it. And so that creates a lot of anti-Americanism. And we may be back in that situation again, no matter how the rhetoric tries to convince us otherwise.